Hey, good morning. We're with Gina Tengler. She is a patient nurse navigator at St. Luke's Baptist Hospital. Good morning, Gina.
Good morning. How are you?
I'm doing well, thank you. Gina, we know that many women typically go to deliver their babies where their doctors tell them to go for delivery. But why is it important for them to know about the comprehensive services offered within Baptist Health System to take care of their medical needs throughout their lives, from childbearing age to postmenopausal age?
Absolutely. Good question. So, from childbearing age, we have a Great Expectation prenatal program. That's mainly my focus. So, I'm there to help the patients navigate through the whole prenatal process before they come in, make sure that they feel as comfortable as possible as we can in the childbearing process. It's nerve wracking as it is. And then we have access to maternal fetal medicine care. So, that's any high risk or complicated pregnancies that any women might have. So we have direct access to those doctors should we need it. We also have a 24/7 dedicated OB emergency room. So this is open 24/7 just to our OB patients, and it's there anytime they need it for anything related to pregnancy whatsoever. We also have a dedicated midwifery program. So midwives, if patients want to have a more holistic delivery, natural delivery, or if they just prefer having a midwife do their care, we also have them at our hospital also. We also have the ability to do GYN surgeries that are minimally invasive. So this is for women who need hysterectomies or any kind of GYN surgery. So it's a faster recovery. We have a dedicated GYN floor that we take care of our patients. We also have a Level IV NICU that we're really excited about. So we can take care of micro preemies. So this is babies that are born really prematurely. So anything that we would need to take care of those kiddos, we have that there in our NICU.
That's wonderful. That's awesome, Gina.
Absolutely.
So, Gina, you work as an OB nurse navigator to help take care of patients during their pregnancy. Can you tell us about your role and how you help patients?
Sure, absolutely. So my goal is to make sure that the patients feel as comfortable as possible. So I'm kind of the go-between between their provider and coming into the hospital. So as women, we kind of want to know pretty much everything from the process of giving birth, what their room looks like, what classes we can take, pre-registration process, anything that's involved with delivery. So I want to make sure that I'm there if they need anything whatsoever. If they don't feel comfortable asking their doctor, I can definitely get those questions answered for them if I don't know.
Okay, that's really great to hear, Gina. So Baptist Health System has dedicated OB emergency departments. Why is this important for patients to have access to?
Absolutely. So we have a dedicated OB emergency room. It's located on the first floor of our hospital, right across from our gift shop. And this is there for our patients 24/7. So if they wake up at 3 a.m., they have a sudden urge that they don't know what's going on, or if they're contracting and they're like, should I call my doctor? Should I not? We're that go-between. So they don't need to contact anybody. They can come in. We'll answer any questions. We'll contact their physician if need be and make sure they get to where they need to go. So they can completely avoid the regular emergency room, just come straight to our OB emergency room.
Okay, that's very convenient and very helpful. So we know that many women may feel nervous about coming into the hospital during this time of the COVID pandemic to deliver their babies. Can you tell us what some of the hospital safety protocols, particularly in the OB delivery procedures, are in place right now at Baptist Health System hospitals?
Yeah, absolutely. So we have limited facility access. So we're screening everybody that comes into the hospital. So get a temperature scan, to get some questions answered, and everybody is asked to wear a face mask, including the designated visitor for our patients. So we're trying to limit the spread of COVID if we can, trying to make them feel as comfortable as possible, let you know that we are only letting in patients that are properly screened, and make sure that everything is taken care of on that forefront.
Okay, excellent. That's great. Are there any virtual or telemedicine options available right now for women who may need medical attention to help ensure that they have a healthy pregnancy?
Good question. So certain doctors are providing that. That's up to their provider as far as if they're doing actual OB-GYN consults and that kind of stuff as far as their care goes. Inside the hospital, if they don't have access to Zoom via their phone, we do have iPads that they can connect with their family members or doula should they need to, or if they want to. That way they feel a little bit more connected, because right now we do have just a designated visitor policy. So there's only one visitor allowed, and that visitor has to stay with the patient the entirety of their stay. So we want to make sure that they feel as comfortable and as connected to the outside world and not just their visitor during that experience.
Okay, wonderful. So there is one visitor allowed currently for the mom?
Absolutely. So we do have a one designated visitor policy. So this visitor is allowed to come in screened with you to make sure everything is great for COVID. They're asked to wear a mask the entirety of their stay, and that person has to stay with you until you leave the hospital. So no coming and going from the hospital. Just make sure that they're there with you. So pack a bag for that person. We do have our private rooms on labor and delivery and postpartum. So you'll have a designated bathroom that y'all can both use.
Okay, that is very helpful and very convenient.
Sure.
So Gina, after the mom delivers the baby, right now, is she allowed to have additional visitors? So aside from her one designated visitor, her support person, can she have additional visitors?
So currently one of our safety initiatives is just to keep our patients safe. So we are just allowing that one visitor. So we want to minimize COVID if we can for the spread. And so just that one visitor, I know it's not ideal, but we are trying our best to make sure that you and your family are safe. So that one dedicated visitor, absolutely, we can use the iPads need be to make sure that we connect with those family members. And you can do FaceTime or whatever, Skype, Zoom, whatever you feel comfortable. We are happy to help you do that.
Okay, that's very helpful and absolutely understandable. We want to help to minimize and reduce the risk of COVID right now. So safety is priority for mom and baby. So Gina, we touched a little bit earlier in our interview about some of the services offered within Baptist Health System. So right now, Baptist Health System is the only healthcare system in San Antonio and South Texas who has 2 hospital facilities with NICU Level IV designations, both at North Central and now at St. Luke's Baptist Hospital. What does that mean for families who need that specialized care from a NICU?
Absolutely. So that means that we can take care of those really preemie babies, which is super exciting. We are so excited that St. Luke's is part of that Level 4 designation, and we can't be more proud of our NICU. Our NICU team is amazing, and they have earned this Level 4 dedication, and we are absolutely super excited. So our patients can trust and ensure that we can take care of those preemie babies and make sure that everything needed for their care is done. So respiratory issues, little tiny kiddos, we're there to make sure everything is good and great throughout the process.
Perfect. That is absolutely assuring and wonderful to hear. And absolute congratulations to St. Luke's on that very well-earned, deserved designation. Well, Gina, thank you so much. We appreciate your time this morning. You've given us a wealth of knowledge about the comprehensive services offered within Baptist Health System. Take care, be safe, and again, thank you for your time.
Absolutely. Thank you so much.